Welcome to Deep Microbiology channel. Today, we're bringing you a quick yet informative video about urinary casts. These microscopic structures can be crucial indicators of kidney health. So, let's dive in and explore what urinary casts are, the different types, and what they reveal about kidney function and disease. Stay with us as we break it all down. Let us know, what are casts? Urinary casts are cylindrical structures formed in the kidney tubules. They result from the precipitation of Tam-horseful mucoprotein, also known as uromodulin, which is secreted by the epithelial cells of the renal tubules. Shape. Their shape is tube-like, reflecting the structure of the renal tubule where they are formed, with parallel sides, defined outer margins, and rounded ends. Before we go deeper, let's review some information about Tam-horseful protein, uromodulin. This is the most abundant protein in normal human urine, and it plays several important roles such as 1. Defense mechanism. It plays a key role in urinary tract infection prevention by binding to pathogens, preventing them from attaching to the walls of the urinary tract. It also helps in kidney stone prevention by inhibiting crystal aggregation, which reduces the likelihood of stone formation. 2. Cast formation. Acts as the structural framework for hyaline casts. It can also trap other elements within the renal tubules, such as red blood cells, white blood cells, bacteria, or cellular debris, forming different types of casts. Finally, ion transport regulation. Tam-horseful protein helps regulate the transport of salt within the kidneys, which is important for maintaining the balance of electrolytes in the body. Now let's talk about the factors that promote cast formation. The formation of urinary casts can be influenced by both physiological and pathological conditions. Physiological conditions such as acidic pH. Urine naturally tends to be acidic, which can promote the formation of casts. This acidity can result from normal metabolic processes or diet. Dehydration, which can occur from not drinking enough fluids or excessive sweating, can concentrate the urine, making cast formation more likely. Excessive physical activity. Intense physical activity can lead to temporary protein in the urine, exercise-induced proteinuria, which can contribute to cast formation. Pathological conditions, such as high concentration of plasma proteins. When there's an increase in plasma proteins, it usually indicates proteinuria, which is often associated with kidney diseases or systemic conditions like nephrotic syndrome. This can lead to the formation of casts. Severe or chronic dehydration. Dehydration can also be a result of certain medical conditions that cause excessive fluid loss, such as diarrhea or prolonged fever. This severe dehydration can affect kidney function and promote cast formation. Now let us explore the different types of urinary casts and their clinical significance. 1. Hyaline casts. 2. Granular casts. 3. Waxy casts. 4. Renal epithelial casts. 5. Erythrocyte casts. 6. Leukocyte casts. 7. Fatty or lipid casts and oval fat bodies casts. 8. Hemoglobin casts and myoglobin casts. 9. Bacterial casts. 10. Pseudocasts or mucus threads. 1. Hyaline casts. As you can see here, hyaline casts are transparent, smooth, and often easily overlooked under bright field microscopy. They are more visible under phase contrast microscopy, which enhances their appearance due to the light scattering effect. These casts are composed primarily of Tam-horseful protein and contain no cellular inclusions, which gives them their characteristic clear, gel-like appearance. Clinically, they can be associated with both physiological and pathological conditions. The physiological conditions such as fever, dehydration, and physical exertion. When the body experiences fever, it goes into a state of stress. In response, the body tends to lose fluids through increased sweating and sometimes through elevated breathing rates. This fluid loss, coupled with reduced fluid intake, especially if the person is feeling unwell and not drinking enough water, can result in dehydration. Dehydration causes the urine to become more concentrated because there's less water available in the body to dilute the urine. In this concentrated environment, the TAM horseful protein, which is normally secreted by the cells of the kidneys, begins to aggregate more easily. As the protein aggregates, it can form a cast, which then appears as hyaline casts in the urine. In the case of physical exertion after intense exercise, the kidneys may work harder than usual. This can cause temporary changes in urine concentration, which can also result in hyaline cast formation. This is important because hyaline casts are not always a sign of disease. Factors like dehydration or physical exertion can explain their presence. In pathological conditions, hyaline casts are commonly seen in the early stages of kidney disease. In these cases, they might indicate mild tubular damage or reduced renal perfusion, which can happen before more severe kidney issues develop. 2. Granular casts. Morphology. Contain fine or coarse brown granules of plasma proteins. Size and granule distribution vary. It is associated with severe systemic diseases and chronic or acute renal disease. Sometimes mistaken for amorphous urates. The key factor to differentiate between amorphous urates and granular casts is the defined cylindrical shape and tubular origin of granular casts, which serve as distinguishing features. In contrast, amorphous urates are irregularly shaped clumps with no defined structure and are unrelated to tubular damage. 3. Waxy casts. Morphology. Highly refractive, rigid, transparent, with angular ends and lateral indentations. It is easily seen in bright field microscopy due to pronounced outlines, and it is associated with severe chronic kidney disease, indicating tubular obstruction or nephron loss. It is also sometimes misdiagnosed with hyaline cast, and the key distinguishing factor between hyaline and waxy casts, as shown in this photo, is their appearance. Hyaline casts are translucent and smooth, whereas waxy casts are opaque, brittle, and often exhibit cracks or serrated edges. 4. Renal epithelial casts. Morphology. Contain renal tubular epithelial cells with round light nuclei. Renal epithelial casts are hard to differentiate from leukocyte casts, so the general term cell cast is recommended when unsure. It is associated with acute tubular injury, such as acute kidney failure or toxic tubular damage. 5. Leukocyte casts. Morphology. Dark, gritty cells. The size of casts and the quantity of leukocytes vary considerably. The abundant leukocytes obscure the contour of the cast, and it is associated with pyelonephritis, indicating infection or inflammation of the renal parenchyma. 6. Erythrocyte casts. Morphology. Contain intact or fragmented red blood cells, appearing yellow to brown. Clinically associated with glomerulonephritis, renal hematuria, and interstitial nephritis. 7. Fatty or lipid casts and oval fat bodies casts. Morphology of fatty casts. Filled with variously sized and highly luminescent fat droplets. Fat can be readily and rapidly stained with Sudan stain for better identification. Morphology of oval fat bodies casts. These contain oval fat bodies, i.e., round tubular epithelial cells packed with fat. The more embedded the fat is, the more difficult it is to identify the epithelial cell. Lipid droplets and oval fat bodies are best appreciated under dark field illumination, because they are highly refractile, and under polarized light, which reveals a characteristic called Maltese cross pattern of birefringence. However, not all types of lipids display this Maltese cross birefringence. This pattern is characteristic of cholesterol and may not be observed with neutral fats. Lipid casts and oval fat bodies are indeed associated with nephrotic syndrome, a kidney disorder characterized by significant proteinuria, hypoalbuminemia, hyperlipidemia, and edema. 8. Hemoglobin casts and myoglobin casts. Morphology: yellowish to brownish-red hemoglobin casts that are granular in appearance. Distinguishing between these two types of casts is challenging. They are found in hemoglobinuria and myoglobinuria. Clinically associated with hemolysis and severe muscle injury, which is often marked by elevated creatine kinase levels. In rare instances, hemoglobin casts are due to hemoglobinuria and may occur in disorders associated with intravascular hemolysis. In these cases, erythrocytes are either absent or present in very small numbers. 9. Bacterial casts. Morphology: bacteria embedded within the cast matrix, best visualized under phase contrast microscopy. Clinical association: severe urinary tract infections with renal involvement, for example, pyelonephritis. 10. Pseudocasts or mucus threads. Morphology: irregular fibrous structures, lacking continuous contours, contain trapped cells, bacteria, or crystals. Clinical significance: not true casts made of TAM horseful protein, often misinterpreted as hyaline casts, but have no clinical importance. Thanks for watching. If you enjoyed the content, don't forget to subscribe to Deep Microbiology channel and turn on notifications to stay updated.